Modifiers. Definition. A modifier provides the means to report indicate that a service or procedure that has been performed has been altered by some specific circumstance but not changed in its definition or code. Modifiers also enable healthcare professionals to effectively respond to payment policy requirements established by other entities. Modifiers can be two-digit numbers, two-character modifiers, or alphanumeric modifiers. If appropriate, more than one modifier may be used with a single procedure code. However, all modifiers are not applicable for every category of the CPT codes. 24 Unrelated EM by same MD during global period attached to EM code when a billable encounter is reported within the global period for a reason that is unrelated to the original procedure or if some other billable circumstance is met. Example: Dr. Smith sees an established patient in his office who had a bike accident. Dr. Smith performs an intermediate repair for a 4.0 cm wound on the patient's forehead. The repair has a 10-day global period. 3 days later, the patient sees Dr. Smith complaining about sinus trouble. Dr. Smith performs a problem-focused exam and diagnoses the patient with a sinus infection. He writes a prescription and codes the visit as a 99,212.24. 25 Significant, separately identifiable EM service by same provider on the same day of a procedure or other service. Attached to EM level when reported with surgical procedures. EM service may be prompted by a symptom or condition for which the procedure was performed. Different diagnoses are not required. However, some payers may require different diagnosis codes linked to the EM and procedure. Modifier must be attached to the EM code when it is billed along with a surgical or medicine procedure CPT code, i.e. wound closure, incision and drainage, CPR, elective electrical cardioversion, moderate sedation. Example: 9928325120001. 26 Professional Component Modifier 26 is appended with global billing codes when physician performs only the professional component service, supervision and interpretation. Professional component. Physician portion of services includes supervision of technician interpretation of results, including written report. Technical component. Technologist service equipment, film and supplies. Certain services provided to the patient or a combination of both professional component and technical component, also called as global procedure code. Examples are shown below. 71,030.26 In this radiology service billed with modifier 26. It means only for supervision and final report. 71030 TC. In this radiology service billed with modifier TC. It means only for technician, supplies, equipment. 71,030 both professional and technical component. 50 Bilateral procedure modifier 50 should be appended to indicate the procedures performed on both the sides, right and left, on the same day, session. If bilateral procedure code not available, then we should report appropriate unilateral code by appending modifier 50 indicating both the sides procedure performed on same day, session. Example: a baby born at 32 weeks undertook 5 photocoagulation health care services to both the eyes due to retinopathy of prematurity at 6 months of age. Provider used an operating microscope during these procedures. These services occurred once per day for a defined treatment period of 5 days. In this example's procedure is performed for both the eyes, hence we report the claim with modifier 50 to indicate both side of eyes procedure performed. 67,229 with modifier 50. 51 Multiple procedures when multiple procedures, other than EM services, are performed during the same session by the same provider. The primary procedure or service may be reported as listed. The additional procedure or service may be identified by attaching modifier 51. Example: a dermatologist performs an excision of a malignant skin lesion. During the patient's treatment, a separate skin lesion is discovered which the physician thinks warrants closer attention. After obtaining consent from the patient to perform a second procedure, the physician performs a biopsy of the new site. To bill correctly and appropriately, the coder would list the surgical services rendered as follows: 12,031 wound closure 11,600-51, excision of malignant lesion 11,100-51, biopsy of skin, single lesion. 52 Reduced services under certain circumstances. A service or procedure is partially reduced or eliminated at the provider's discretion. The service provided can be identified by its usual procedure number and the addition of 52. This provides a means of reporting reduced services without disturbing the identification of the basic service. Example: if gastrointestinal tract imaging, intraluminal e.g., capsule, endoscopy, esophagus through ileum, with interpretation and report performed, we use the procedure code 91110. But if the ileum is not visualized, then we append modifier 52 with procedure code 91110. 91110 with modifier 52. 54 Surgical care only attached to surgical procedures with a 90-day global period when the treating provider performs a surgical procedure and another health professional provides preoperative and/or postoperative management. The addition of this modifier cuts the global period to 0 days. Subsequent EM services are billable. Example: Dr. A performs the pre-op visit and the major surgery. Therefore, he receives 10% of the physician fee schedule amount for the pre-op period and 70% for the intra-op period when billing with modifier 54. Dr. B covers the patient for the entire post-op period. Therefore, he receives 20% of the physician fee schedule amount when billing with modifier 55. 57 Decision for surgery and EM service that resulted in the initial decision to perform the surgery. Attached to EM codes when reported in addition to a 90-day global period procedure. All payers. Example: an orthopedist examines their patient and discerns the need to perform non-surgical fracture care. Closed treatment of a clavicle fracture, whether Captain 23505 with manipulation, or CPT 23500 without manipulation, is not technically surgical in nature, but is a major procedure that has a 90-day global period. In this case, separate payment of an EM service with modifier 57 is appropriate.